Hi everyone, my name is Erica Kazmarzik and this is my presentation on healthcare reform. We're going to talk about the need for healthcare reform prior to the Affordable Care Act. We're also going to talk about the Affordable Care Act and its drafting, passing, implementation, and the implications of it. We're going to talk about public opinion on numerous different things, including the need for healthcare reform, the Affordable Care Act, and the future of healthcare in America. Now, before the Affordable Care Act was passed, the need for healthcare reform was evident due to many common patient complaints. Some of these include the cost of healthcare. Patients complained about the rapid growth of healthcare and rising out-of-pocket costs. Pre-existing conditions. Patients with pre-existing conditions such as asthma, diabetes, and heart disease were often denied or charged higher prices for coverage. And we had a very high uninsured rate. About 47 million people were uninsured in 2006, according to the Kaiser Family Foundation. Medical debt was a growing problem, with 41 million people reporting financial difficulties due to medical debt. Public opinion about the healthcare system prior to the Afford Act was generally poor. Healthcare costs prior to meaningful reform were growing at an alarming rate, higher than the normal rate of inflation. Individuals and families were spending an increasingly large portion of their incomes on insurance, and the reason for the rising cost of healthcare include greater demand for services, investment in expensive technology, lack of public funding, and government regulation. In this chart, you can see the growing healthcare expenditure from 1990 to 2008, and in this chart, you can see the rate of increase in healthcare expenditure versus the rate of increase in overall inflation. The inflation is in purple and the healthcare expenditure is in pink, and you can see that the healthcare expenditure line is showing a much higher rate of inflation than the overall inflation. Pre-existing conditions of medical underwriting prior to any meaningful healthcare reform efforts. Insurance companies were able to use medical underwriting to deny or limit coverage and charge higher rates for people with pre-existing conditions. According to a report by the Commonwealth Fund, 36% of adults who had ever applied for insurance had been denied coverage for a specific medical condition, denied coverage completely, or paid higher premiums. The uninsured rate prior to any meaningful healthcare reform efforts in 2006, according to a report by the Center on Budget and Policy Priorities, there was a record 46.6 million uninsured in the United States. Health rates of the uninsured can lead to higher rates of medical debt for uninsured individuals and higher premiums for those who are insured. In 2008, $42.7 billion worth of care provided to the uninsured went unpaid, and the average family paid $1,017 more on their insurance to cover this deficit. Medical debt became an increasingly significant problem as well, and more families struggle financially because of unpaid medical debt. According to a report by the Office of the Assistant Secretary of Planning and Evaluation, 41 million people reported financial difficulties due to medical expenses. Medical debt can lead to increased stress and even worsen medical conditions and health outcomes. Public opinion about healthcare prior to any meaningful healthcare reform efforts, and due to the reasons that we previously outlined, was falling very quickly. In 2006, only 1 in 8 Americans thought that the U.S. system was working well. Healthcare reform became an important policy area during the 2008 presidential campaign. Here are some important dates for the Affordable Care Act and healthcare reform in general. President Barack Obama was elected in 2008 after running a campaign that promised significant healthcare reform. President Obama starts off his presidency by holding a healthcare summit in March 2009, where he brings together lawmakers, physicians, insurance company representatives, and policy experts in the area of healthcare. He outlines key areas of improvement and goals that he has for reform and challenges Congress to write and pass meaningful, sweeping healthcare reform. Both the House and the Senate wrote multiple pieces of legislation, and after months of politicking and ping-ponging in Congress, the House and the Senate finally agreed and passed legislation and moved it along to the President's desk in March of 2010, when he signed it. On the day that President Obama signed the bill, 26 states challenged the legality of the Medicaid expansion and the individual mandate. An organization known as the National Institute of Independent Businesses and some individuals also filed suit against the Medicaid expansion and the individual mandate. The case became known as the National Federation of Business versus Sebelius. 13 other states filed friend of the court in support of the Medicaid expansion and individual mandate. Eventually, the Supreme Court upheld the constitutionality of the individual mandate and the Medicaid expansion. The effects of the Affordable Care Act are still being recorded, but what we can see so far, we can see a declining uninsured rate, declining growth rate in the healthcare expenditure, but still a growing per capita healthcare spending. In this chart, you can see the uninsured rate from 2006 to 2016. The dotted line shows you the trend line, which is negative overall. And in this chart, you can see the healthcare expenditure growth post the Affordable Care Act. It is still growing, obviously, but it's growing it's not growing as fast as it was before. And you can see that highlighted in this chart here, where you can see the percent change from previous year, and you can see in the trend line that it is a negative growth overall. However, in this chart, you can see the per capita healthcare spending, and it is still increasing, and it's still very high. Healthcare costs in 2014. Healthcare costs under the Affordable Care Act are still high, but where is the money actually going? So you can see here in the purple, most of what we're spending is going to hospital services. You can see physician and clinical services. Other services at the top in pink is also a big portion. And then you can see that we're spending a little bit on prescription drugs, long-term care, health insurance, medical equipment, and this tiny little sliver is public health services. The future of American health care. President Trump ran a campaign that promised to repeal and replace the Affordable Care Act. Congress put forth a bill titled the American Health Care Act in early 2017. The Congressional Budget Office estimated that the ACA repeal and subsequent passage of the HCA, 14 million people would lose insurance coverage during the first year, 20 million by 2020, and 24 million by 2026. The HCA was eventually phased out by President Trump and Speaker of the House Paul Ryan. President Trump is still promising to repeal and replace the Affordable Care Act and wants to quickly push through another bill before his first 100 days in office are over. On this diagram, you can see a timeline of 21st century healthcare reform. In 2003, there was the Medicare Drug Improvement and Modernization Act signed by President Bush and the creation of health savings accounts. In 2010, obviously, the Affordable Care Act. And then in 2014, you can see that most ACA mandates have become effective by that time. And then down on number 5 in purple, you can see that the repeal and replace effort, Republicans in the House and the Senate continued to pass legislation to repeal and replace Obamacare through most of his presidency, but none of them were ultimately signed into law. And then in number 6, you can see the American Health Care Act, led by President Trump and Paul Ryan. It was failed to pass, and it didn't turn into law. In conclusion, healthcare prior to the Affordable Care Act was unaffordable for many people, unavailable for others, and unacceptable for most. The Affordable Care Act solved many problems that Americans complained about, including guaranteeing coverage for people with pre-existing conditions, expanding coverage to the lowest income Americans, and guaranteeing coverage for certain services. The future of the American healthcare remains uncertain in the face of political challenges to the ACA and continuing promises to repeal and replace it. Thank you for watching. I appreciate it.